today.
Likewise.
I've known you as a song for quite some time, a couple of years now. However, you're now Mrs. Somebody.
Mrs. Nkingaso.
Mrs. Nkingaso, great. You go ahead and introduce yourself to us.
Hey everybody, my name is Mrs. Nkingaso, like I just said. I am a licensed occupational therapist.
Great. Let's dive right into it. So tell us, what's the difference between occupational therapy and physical therapy? Because people don't really know the differences. And I found myself calling you a physical therapist severally, and it was a struggle before this interview. So please, can you differentiate for us?
Yes, I'm going to differentiate it, but first I'm going to tell you what occupational therapist is. So occupational therapist is the use of function to promote health and wellness. And what really that means is that we work with patients from children all the way to older population. We work with facilitating the ability to function independently on their day-to-day activities. So, going back to your question about the differences between physical and occupational therapy, a lot of people do think that we do the same thing. We are very similar yet very different. Physical therapy focus on ability to walk like your gait, your
Right.
balance and stuff like that. But we more on a different side of it. We are more focusing on your ability to care for yourself from your day-to-day activities, from dressing to toileting to just functioning independently within your community. So we use cognition, sensory, and motor skills to address these things.
Wow. I do see what your colleagues do in the hospital because I work in the hospital setting, and it's quite interesting. You can help the patient with things as little as brushing your teeth. You might think this is not important, but
Trust me,
once
until you get
someone
there.
has a critical illness, it can get to the point where they're not able to even perform these activities of daily living. So I really see the impact that you have on these patients, and it's quite amazing.
Yeah.
So tell us, what's the career path to becoming an occupational therapist?
Just like every other profession, it's quite straightforward. You see what I mean? But I would say that first thing first, let me just use myself as an example so it makes it easier for people to understand, whoever is going to be listening. So, first thing first, I graduated from high school. After I left high school, I was more of that student that wanted to cut down finances and expenditures. So
I know that for sure, because you used to say how, hey,
Yeah.
why would I go waste money when I can start at
Exactly.
community
So I
college?
enrolled at community college. At the time, occupational therapy was not in the picture. So I went to community college. I did general studies. And along the line, I wanted to be a nurse. So while I was doing that, it was nice I went ahead to look up the universities that did offer nursing careers. So Bowie State University at the time was good because it was closer to my home. So I did general studies, then I transferred to Bowie State University, and I transferred to Bowie State University immediately. I didn't enroll in the nursing program immediately. I think I was late or something like that. So my counselor at the time advised me to take up another career while applying for the next cycle for the nursing. At that time, I had enrolled in child and adolescent studies at the time, and I was minoring in psychology. He was like, it's okay to always stay within that university until it's next time where you can just transition from just one career to another. It was easier because it was within the same institution. So I thought it was a very good thing. So I enrolled in that, and throughout the time, this was a whole year. So throughout that, I was still doing my research, and every time I would see nursing students just dragging that big box. Trust me, it was not fun.
Very big.
Very big box. And then I'll come home. I was living with my aunt at the time. She too was a bedside nurse at the time. She now is a DNP. And she'll come home every day complaining, my back hurts, my leg hurts, my head hurts. So I'm telling every time when she says that, I ask myself, is this what I want to do? I'm going to school this much, suffering this much, and we all know nursing school is not for the weak. And I'm telling myself that, do I see myself doing this even for the next 5 years postgraduate? Because if my aunt comes back from work and she's crying this much, I don't think I want to do it. Immediately I said that, I had a change of mind. I was like, God, I know I don't want to be a nurse anymore, but I want to still stay within healthcare. I don't want to lose my prerequisites that I've invested so much time in doing. Not just that, my love for healthcare, I wanted to stay, but in a different path other than just nursing. In doing so, I went online. I started researching. I was like, what can I do with this degree that I'm currently working towards. And one day I stumbled between physical and occupational therapy online. And it kind of drew my attention.
By just researching
By just
randomly.
researching. Nobody told me about it. So I was just researching. I was that kid that I wanted to hurry up and finish school, and because school itself is not fun. It's too much. It's time consuming. And if you're that one person that has some good vision,
Have you ever met a smart person that doesn't like school? This is one of them.
Anyway, so I wanted to hurry up and not just be done, do it the right way. So I got online, I saw physical therapy and occupational therapy. I said, what are the requirements? What does it take for me to get here? And behold, all it said was that you need to at least have a first degree in anything, but preferably health. And mind you, I was already doing child and adolescent studies, and I was minoring in psychology at the time. So they said, according to what I read at the time, is that you could, once you have that first degree, you can then reach out to the schools that are offering the program and make sure that you have the right prerequisites to apply for their master's program. At the time, I know that's when I even realized that they have physical therapy assistant, occupational therapy assistant. And with that, I don't know how it is now. You didn't really need a first degree to go. But then I was looking at myself, I'm too young. I don't have kids. I don't have a husband at the time. Why go for an assistant program when I can just invest my time and go for the master's program? So I didn't look at the direction of the assistant program.
So you're saying that you can actually get the degree at a bachelor's level?
No, you have to at least have a bachelor's degree to apply for the program. You cannot apply for the program. It's a master's and a doctoral program. So it's like it's just like every other career, right? You cannot do a master's in nursing without at least going through a bachelor's in nursing. That's just how I'm saying. So anyway, long story short, I came to my advisor. I said, Dr. Bullock at the time, I don't know if you see that Bruce University. I came to him. I said, Dr. Bullock, I think I found what I want to do. He said, what have you found this time? You're always finding things. I said, I think I want to be an occupational therapist. He looked at me and said, that's good. Something in me just gave me peace. Mind you, I've not told my parents. I've not told my parents. He was the first person after I decided. I meditated over it and I decided that's what I wanted to do. So I went to him and all he said was, that's good. He said, so what are you going to do with your nursing? So this is over time. I received an acceptance letter in the nursing program. And it was within that time frame when I had just concluded with my decision that I'm no longer interested in nursing. So at that point, I was he's saying that you're
a web of
ethical dilemma, or how you say ethical distress. I was just like, what do I do? Now I've gotten this acceptance letter. I've made up my mind that I don't want to do nursing anymore. How do I tell my parents? How do I go about it? Everything was just rooming in my brain. Because I told my parents how I want to be a pediatrics practitioner and I know how good I am with kids. So he said, if truly that's what your mind tells you, go for it. Your parents will find a way to be okay with it. When he said that, he concluded everything.
Right.
So he said, I'm going to go ahead and switch your major now. Because it was a tentative major at the time. Because then, you remember it was on a condition that once I get accepted, I was going to switch. But he was going to make it my major at the time because I've decided I'm no longer, so I had to decline the offer. So I did that without my parents' knowledge.
First of all, for you to be accepted into nursing school, it's a process.
It's a process.
So for her to let go of that and look into what she actually wanted to do,
so
determined.
So he switched it. I came home and I called my siblings and I told them that I switched my major. My siblings were okay with it. They didn't have a problem with it as long as my older sister, especially two of my older sisters, they trusted me so well. They knew that if I could come up with something like this, it means I've done my in-depth research about it for me to just get up and say no to nursing. So now I had to tackle my parents. I went to my parents and my uncle was not having it. My aunt understood me. You see, very understanding lady. And she said she wasn't very happy at first, but after a while she was like, I know what these people do. It's okay, you can go for it. Eventually my uncle accepted it. So that's how I got into.
And I really think it's because a lot of people are so stuck to the idea that the money is in nursing. That's what we're encouraged to do. We see people that have done nursing and they're doing well. You don't know the personal challenges they might be facing, but they're living a decent life. So you're like, why not go ahead and go into this?
Exactly.
You know, I like something. I picked 2 points, very important points from what you said. And the first one is that you asked yourself a question when you saw what your aunt was
Yeah.
going through, you ask yourself, is this something I see myself doing for the
Doing. Yeah,
next
you want to
5
always
years?
ask that question,
And one thing I've always admired about you is that I've liked this sense of identity that you have about yourself.
Thank you.
You're a visionary, you know exactly what you want to do,
Yeah.
and you go for it.
You have to think about
I've observed you over the years. From high school, you went in for your associates. In no time, you got your BSN. Then you just went straight into your master's
There
at
was no
school.
time.
And I remember I hadn't seen you for quite some time. And then we finally met at a grocery store. And I remember at that time, I had told you that either I had taken a break from school, I was planning on going back. And the lecture I got from this girl that day, I said, I told myself, if I don't go back to school and she sees me somewhere, I don't think she's going to speak with me, because I'm talking about I'm holding groceries. And I told this girl, hey, I didn't say I'm quitting school. I'm thinking about going back. But the lecture I got from you that day, and I'm like, you know what? You're the kind of person that people want to identify with, because you're very encouraging, you're very inspiring. And I really like that aspect of you. Not only school, this girl got married in no time. I'm talking about everything. She was on it.
I did have challenges though.
Right. Nothing without challenges. But what I like is that you just know what you want to do.
Exactly.
And you go for
Just
it.
pray for it. I always tell people, even something as little as home health aid, it's not easy. Just find that career path and stay there. No matter how hard it gets, if your heart tells you that this is what I want, trust me, there will be mountains, there will be everything. Stay there. It come to pass. Mine came to. I have a whole story about it's a different day story, but I have a whole story of the challenges that I encountered when I was in graduate school, from giving birth to. Let's
You see the picture on my thing. Oh, she has it easy. She has.
I had.
But I definitely
It was
being
not
young
easy.
and then going from one step to the other. Before you knew it, you became a mom, managing that with your career.
Yeah, it was interesting. That's all I can tell you. But I knew what I wanted, and also having a very support system. Don't forget that, because you cannot do that without having support. When I mean support, my family. My husband was like.
She has a beautiful family, by the way.
My husband. I don't know.
Well,
how
my
to say
opinion, because I know.
Because you cannot do that program and be a full-time worker. You see what I mean? That's what I mean, that having that solid system, having that solid support is ultimate. Because without my husband just taking over everything about my life at the time, and my family just being there and doing one thing from one thing to the other, I would not have made it. Because
marry a good spouse. She married young while in school, but her spouse was supportive.
Trust me,
so
yes. Throughout my time in school, there was no way, there was no means for me to study, because the program is designed like that. Okay. So oftentimes you hear people say, oh, I'm doing my master's program. Oh, I'm doing 2 classes. At most you hear is 3. But the program itself is designed just like nursing. I say nursing because you understand what I mean by it's structured from when you get to your first day of class to when you graduate. You don't get to pick and choose.
Yes.
There's a semester where you have 4 classes, sometimes 5, in a graduate program. Because I did hybrid. Wow. So it's a killer. So there's no way you can handle that. Some people do. Kudos to them. I could not. So,
of course. You mentioned something again that I picked, which is very important. You had a mentor. While in school, you had someone you could go to that could track your progress and advise you towards your career path. Was this person an occupational therapist or just
he had nothing to do with what I was studying. It was my counselor at the time at undergraduate, when he encouraged,
but I admire the fact that you have someone, because a lot of people, I don't know if it's also because we come from a place where back home we like to keep to ourselves. We feel like once they send you to school, you're there to study, have good grades, and come back home. But you're also there to network.
I was
people
going to
don't
say
understand the importance of networking. I've gotten to places not because I was just a student. I was intentional about interacting with certain people.
Open your mouth and ask the right question to the right people. That's just what it is. Remember, mind you, I said ask the right questions to the right people. That is different. It's a big difference if you understand what network with the right people. Because you will meet an association of people where at the beginning it will all seem like it's a good, healthy network. But when the moment you get into it, you realize that no, this is what I did not anticipate this getting here. Get yourself out while still very early. See what I mean? So that's just what I mean.
It's okay to take a step back.
It's very okay to take a step back. Very, absolutely okay. That's especially amazing. When you are in a rigorous program like that. It's not the time to sit down and make all the irresponsible jokes, if that makes sense. It's no time for that. So if you encounter yourself and you're one who wants to pursue a career of search, it's probably not the right circle for you. That's all I can say. Trust me,
Amazing.
believe it or not, it's not the right circle.
Great.
Yep.
So while in school, you got pregnant. So tell me, how did you, while in occupational school, as
In a graduate program.
right, in her
Mhm.
graduate program. So
Mhm.
how did you cope? Did you have to take a break at some point?
No, there was no
Because
break.
I've seen a friend go through that process while in nursing school, and I know it was a challenge because at some point she said she thinks she's having a baby brain. She was forgetting assignments,
Yeah.
and that was unlike her. Like, this is not
Yeah,
someone that
it
I
happens.
knew. She was on it, reminding me. I was reminding her, but sometimes I was just like, "Hey, girl, yourself.
But
What's
she did
going
not
on
quit,
here?"
right?
She did not quit. She kept
Exactly.
going.
That's what I
So,
mean.
right.
Those are the challenges that I mean by saying that they will come, so the forces will come to a point where you feel like, God, I think if I take a break, you'll understand. He's not going to
You have a
understand.
reason.
Trust me. He's not going to understand because he has a purpose for you. We all have different purposes. That's your purpose, at least for that time. Stop giving him reasons as to why you can't do it, because he saw that you could do it before he gave it to you. You asked me a question. Let me try to answer it and be brief about that. Yes. When we did our orientation, we were advised, oh, this is not a program that you want to have kids. If you don't already...
And I tell you, for my friend, they had a meeting with her and told her, hey, we think you should take a break, actually.
She did not. Did she
Did.
pass her board?
She did.
That's what I'm saying. It boils down to having the support. Trust me, if you don't have the support, it's absolutely okay to take a break. With the support, that's the best way to put it.
It's not easy, right?
I had a baby. Throughout my first year, I was good. So my second year, I got pregnant. I thought I was going to die. The moment I found out, and all my husband said was, we're going to get through this together. If God didn't want it, he would not have given us this baby. So with the baby being in our midst, we're going to get through it. So Leah was seen as my motivation. So every time I got to a point where I could not push forward, I said, Leah, truly, if you want me to be an example in your life, give me a reason to keep pushing. And out of nowhere, I'll do it. And just praying, stay prayerful too, because you can't do this by yourself. So that piece of it should really come first. You have to pray for vision. You have to pray for strength. You can't pray and not do the work. It has to go hand in hand. I prayed, I worked, and it came to pass. That's just what I would say. Let's not get into...
Don't pray and sit down and say God will do it for you.
Work.
You have to work.
Pray for strength,
together.
Pray for vision, pray for courage. Don't pray for him to do it for you. Pray for him to help you, to see you through it. You see what I mean? If that makes sense. But it's just not to take too much of...
Great. Let's get into what I like. So would you say occupational therapists make 6 figures?
Yes. Initially, let's put a disclaimer to it. As an entry-level therapist, and this applies, I would think, to almost every profession. When you're an entry level, meaning you're a newbie, fresh off graduation or whatever, most likely you might not, only because of your level of experience. You just got out of school. You're really in a way still...
Same applies to nursing.
Exactly.
Actually.
You're really in a way still navigating, figuring out your way out of it. At that point, you're still using your books. You're still carrying your books. You have no clinical experience aside from the 6 months rotation that you did. That's all you can hang on.
Right.
At this point, you're still using your book. So it kind of justifies why it's probably not realistic to get to that figure. But as you build your experience over time, yes, why not?
Great. So for those of you who are looking for professions that have money, hey, don't follow nursing because of money. Because one thing about nursing I've realized, if you don't have the passion, I don't think you're gonna
quit.
Yeah, you're gonna quit because it takes a lot of hard work. It takes a lot to be on the floor. You're almost losing strength at some point.
I see it every day.
Yes.
So
you definitely have to have that.
First of all, I want to give you guys credit. Nurses are the backbone of healthcare.
Yeah.
Because everything goes through nursing.
Right.
Nurses. Oh, let's just say, for example, I need my patient at 8:30 and he or she needs to have their medications in. Who do I go to? I don't go to the med tech. Med tech gets orders from nursing. You see what I mean? I go to the nurse and say, I need Miss X, Y, and Z to be ready by 8:30. What does that mean? Please have their medication in by 8 o'clock so it takes time to simmer before I come and get them at 8:30. So everything is channeled through nurses. So that's why I'm saying that you guys are the, how do you say, the goats?
The goats. Great. Let's talk about our community. We come from somewhere, we came here, we're in the diaspora, we're trying to make a living out of ourselves. A lot of people are not exposed to the idea of other professions. So I remember we're having this conversation where like, you're the only Cameroonian occupational therapist I know.
I know
Why
one other
is
person.
it?
I know one other girl, lady.
Well, you
from
know,
our community.
if we're at the hospital where I work at, there's literally, I don't think anyone from the community that
Where we
I
come.
see do this profession. So why, I do see a lot of nurses, of course. So why do you think we divert our attention towards a specific career? Is it a cultural thing? Honestly, personally, I think that as Africans, we're trained to be nurturers. I think we have that in us.
We
so
have
we
it.
feel like,
It's inborn.
exactly. So nursing is that profession where if we find ourselves in, we can easily cope with. But why do you think a lot of us divert towards that area, towards IT? We don't really explore. There's so many professions to explore out here, and actually that you can make decent money from. But why do you think we're just so specific about tied to a certain profession? I must say.
You just said it. We don't do research.
You
Just
mentioned that at
simple.
the beginning.
We don't do our research.
Right.
We are not open for ideas. You come and this person tells you nursing is the goal, nursing is a thing, nursing is. They give you all the blessings of nursing. Tell me why you're not going to do it.
That's
It
true.
takes
That's what you've been
courage.
exposed to.
Exactly. That's the only thing you know. Then they tell you, trust me, nursing is good. I'm not saying it's not good. I'm just saying that we are too narrow. We are not open to exploring other opportunities out there. Had it been, I didn't take it upon myself to go out there. I told you, nobody told me about becoming a therapist. Had it been, I didn't take it upon myself to say, let me see what is out there. You see what I mean? You really have to take it upon yourself and say that I want to be a healthcare provider, not necessarily in the nursing direction, but in a different discipline. You will find a lot of things from clinical social worker to clinical psychologist to physical therapist to speech therapist to occupational therapist to respiratory therapist. It's a bunch of branches of therapists.
Right.
That's to stay within the healthcare system. See what I mean?
Right.
And you have nothing to do with needles or medicine.
Especially people that are scared of needles,
Exactly.
but still go into nursing.
But you're still within that healthcare,
Right.
making the same, almost more than what the nurses are making. If only we can take it upon ourselves.
Hey, don't come for us. We make money.
No. That's what I'm
No,
saying.
I get it. Yeah.
I'm just saying that why we are so grounded into nursing. We are not open for change. Some people are open for change, but yet they know the value they're going to bring to the table when they talk about nurses. That's different as opposed to, I've encountered people where they say, oh, if I knew about this. Oh, if I knew about this. So these are the category of people I'm referring to.
And just like nursing, your profession is very flexible.
It's very
you
flexible.
currently work in the outpatient setting.
Work in skilled nursing.
In skilled nursing. So describe what's that?
It's
your
a
rehab facility.
Yeah, a rehab
facility.
Great.
It's very flexible. I do work with occupational therapists at the hospital, so you can work in
hospital is called
home
inpatient.
Setting. Inpatient,
Yeah.
Okay. And you can also work in people's homes if that's what you decide to do. So
there are a multitude of places that you can work, and I'll give you an example. I work in a rehab. I work in a skilled nursing. You have outpatient. Outpatient are the people that are well enough to leave their homes and go to a facility, get their therapy, then go back at home. You mostly see this in people with surgeries like knee surgeries, orthopedic patients that first come to rehab, get well enough, then they can go home, then continue with outpatient. Because I do that a lot. I discharge my patients when they're ready and willing, and they have the right insurance that can support that. You have inpatient, which is hospital. You have acute care. You have home health. You have mental health. You have school. You have daycare centers that offer. It's a whole lot of places that you can work in. Excuse me. So we are very flexible.
Do you need a doctor's referral?
Yes.
For physical.
Yes. To assess a patient, you need a doctor's referral. A patient cannot walk into my facility and said, oh, I'm having issues with my daily activities, and I go ahead and assess that. First, I need to refer you to your doctor. Then once you've been assessed and deemed necessary, then the doctor gives me a referral. Then I do my assessment. So it's a process. You see what I mean? Once I do my assessment, I do come up with your plan of care. I write my own orders and I send it back to the doctor. So it's a whole process to finally actually get into the treatment piece of it.
So we're living in a place where we can easily access this resource of either an occupational therapist or a physical therapist. Now, in a place where people don't easily have access to even the hospital, or and then they find themselves in a situation where they're critically ill, or the doctor does give a referral that you need an occupational therapist, and they might find themselves resistant to the idea because they've never had it before, or when they explain to them what it is, they might be like, my picking for house fee help me with this thing. Someone can help me with this thing. What would you say to them makes the difference with actually working with a professional?
We are constantly educating. You have to educate when you're talking from the time you walk into a client's room.
Sorry to interrupt you, because I want people to know the importance of this. For instance, let me just bring it down to a basic level. If someone has a stroke, it could be so bad to the extent where they cannot talk.
Yes.
The things they did before normally, and even brushing your teeth,
They lose their
cannot do
ability.
it. Yeah. And this is where an occupational therapist would come in to say that, hey, let's get you back to at least where you were, or at least closely, because you set a goal for the patient. You work, it's an individualized thing based on where they are. So we were talking about people that are resistant to this idea.
Trust me, I've encountered a lot of them, and I give them time to really think about it. Then they come back and say, I tried to use the restroom, but I was not able to. Of course, you understand it. Trust me, you have to be very empathetic. You need to understand that losing your independence after being born with it, it's not easy to comprehend. All right? So give these people time to process what is happening to them. If you come to a client's room and they are very impulsive, leave, report, and give them time. It's not always going to happen. Some patients need an immediate attention, some of them a little bit more. But you come to a patient's ward, you really have to, I would say, put yourself in their shoes when you talk. Don't just talk as a healthcare provider. Talk as someone who understands, not know it. There's a difference between understanding and knowing. So just to answer your questions, we are educators. We educate our patients. First, you need to make sure that they understand what occupational therapy is. You need to understand what we do and why we are coming to your room. You see what I mean? You cannot come to a patient's room and assume that they already know what occupational therapy. 9 out of 10 times they're not going to know what it is. And sometimes you hear a patient say, I'm retired. I don't need no damn occupation. Because of the word occupation, the thing is your career path. No, it has nothing to do with occupation. Just it's an umbrella term that defines your activities of daily living. But then when you start to break it down and put it in a way that they will understand and say, oh yeah, that's true. I can't even raise my hand after I had my stroke to brush my hair. My left side is so weak in a way that I can't even support myself when I walk to the bathroom. Then you come in and say, that's why we are here to facilitate your ability to be able to do these things in the midst of your challenges. We are holistic. Holistic just means that we deal with all of it. I see that you have this. So how can I help you to still be able to maintain that independence? Hold on to it to as long as you can, because it's very vital to you. You see what I mean? So you see the approach that I use. I did not come in there dictating to them, we got to do this because it's important. It's important to them. That's why they're there. But they need you to educate them, make them feel comfortable, make them feel safe. Create that environment of rapport where they'll be open to explain without being judged. You see what I mean? So that's what it is.
Right.
You gotta give them time to think. That's all I can say.
All right.
Give them time
Coming
to think.
to the end of this, I want to ask you, Aso, where do you see yourself in the next 5 years from now? I know where I see you, but I'm not going to say it because it's personal.
Trust me, I'm a lady. I like school. I'm constantly thinking.
This guy's already talking about me getting my PhD, just so you know.
With me not even going to school now, it's almost like part of me is missing. But then I want to give it time because I do have younger kids. And
how many do you have?
I have two.
Two.
I have a girl and a boy. So my attention is on them now, because they say between the ages of 0 and 5 is when the brain development spike. So I want to be there as much as I can. But where do I see myself in 5 years from now? Going back to school, establishing more, and possibly opening my own place. I don't know. It's just too much. I'm
going to tell you, I saw where she's going to be in the next 5 years, but I wanted her to say it herself because you've heard us talk and you can already tell. You're looking at a millionaire. So
Oh.
maybe our next episode will be let's interview the millionaire occupational therapist.
Why
I
not?
so believe it's gonna happen.
Amen.
So you're just the right person for the job. I've listened to you speak and it's so refreshing.
Oh,
You have passion for this, you know what you're doing.
Oh.
Whatever facility employs you, I think they need you. It's great.
There's very few of us out there, so
You're doing it well, which is great. One last question. I want to know this for myself because you're such a great mother. She came here today and she was talking about her planner for the week for her daughters.
You're putting me at the spotlight.
See, people need to see diaspora already. We're so busy with life. We're so busy with meeting up with bills, getting a second job, and people do this with families. I'm talking about they have a husband, they have children, and some people might find themselves neglecting their kids, not because they don't want to, rather,
It's the
but
circumstance
because
that they
the
find
circumstance they
themselves.
find themselves. So how do you manage it as a parent? You're so involved. You're creating a planner for your daughter to learn her alphabet, her numbers. How do you do it?
It just happens. So once you find that love of doing, everything comes naturally, if that makes sense. So one blessed thing about my career is that it's very flexible. I get to work around my daughter's school. So once I pick her up, I'm done for the day.
Is it too late for me to consider career OT?
No, excuse me. No, it's not.
You're actually very flexible. You say sometimes you're done at 12 or wow.
So I do have nurses that are therapists now. So yes, it's not too late.
My journal,
why not? So work-life balance comes in handy. It's very, very easy to have that flexibility. I'm able to, like I said, when I pick my child up, I'm done. Then when I come home, I have to put that therapy hat away. I have to be a mom and I have to be a wife. When I enter my house, all of that is done. This is my occupation now, a mother.
Very intentional.
And a wife. That's the time where a lot of people call me. It's hard for me to pick up my call because I got to put things together in preparation for the
that's
next
exactly
day.
why I say very intentional, because you know what you want to do and you're focused on that at that moment. You don't let distractions sway you away,
because
which is important.
You got to be very structured when you have little kids, and especially when you have a school-age child. They're constantly having homeworks. They're having meetings here and there. Sometimes I do forget. I'm not perfect. Trust me, I forget. And like my sister will call me and say, "Do you know the have?" I said, "Oh my goodness, I forgot about it." It happens. Don't kill yourself about it. It's normal.
But Asong, do you really think I've caught her Asong for years, so I'm used to it?
Excuse me.
Being prioritizing your needs, it really plays a big role in you being a good parent.
Yes.
Because at times we can be everywhere and we think that the reason we're not in our children's life is because we really cannot be there. But are we really prioritizing what we need to prioritize?
I'm glad that you brought that question up because yes, you have to prioritize. I told you the most important thing, the important stage in a kid's life. I'm not just guessing it because I went to school, I have done it, I've experienced it in other people's kids. The most important stage is between the age of 6 and 5 because at that point, their brain, their neurotransmitters, everything is spiking. You have to be there as much as you can. Like I said, life gives us, we often find ourselves in a situation where we cannot really control. But do your best as possible to be there. On days that you cannot be there, let it be a legit reason why you cannot be there. I've had people scolded at me for not going out, for not attending occasions. Mind you, I do attend occasions, but I have to prioritize things. If it entails taking my child to that place, I have to weigh the importance of it. Is it that important to have to deal with the hassle of dealing with 2 kids in an occasion? Or can I just meet up later? If the answer is meet up later, so be it. It's okay to get angry. Like you cannot always please people.
And by the way, we've postponed this interview severally because of, like you said, she prioritizes things, and so she has to do something at a certain time. She has to do it, and that's right.
Just life. So you have to prioritize. You have to map out a mental plan in your head. I work with a planner. When I mean planner, I mean my calendar in my phone. I put things so that I don't forget, especially when it comes to my daughter's school, her upcoming activities, because if I forget, she'll remind me. So you don't even want to put yourself in a situation where she feels that you're passive with her. You want to make her feel that you're actively present. It's different from being present.
That's so true.
You see what I mean?
Because children,
They can tell. You can be there and be passive. You can be there and be active. If you're there and the child doesn't feel your physical presence, you're passive.
right.
If you're there and they know that mommy and daddy are giving me their attention, they're answering my questions, you're active. So that's what I mean.
It was a pleasure having you today.
Yeah.
I'm very glad to have you, and I
Likewise.
hope the next time we're talking, we'll be talking as this is the next
Amen.
millionaire in the making. Thanks for coming.
Amen. Thank you.
I'm so
Thank
glad
you, Bob. I hope to make more videos and
you heard that. She's coming back.
Anyway, thank
Bye.
you. Bye.